Yeah.
On this runway show?
On this runway show.
That's awesome.
But it was,
Great. Welcome, everyone, to Scholar
one
Support
shoulder
on
bathing suit,
July
so she just came out
17th,
breastfeeding her daughter.
2018.
Yeah.
Wow.
We're actually waiting for other people to arrive, so we will be probably another 5 minutes. We can pause it.
Mhm.
Right?
Have it started yet?
All right. So hello, everybody. Here. Maybe what we'll say, everybody that's here now, and and also hoping that maybe people could join us online. If you are online, let us know by hitting chat.
We'll know if someone's online.
Okay.
It'll show up that someone else is on.
Alrighty. So I'm Jenny Weaver, and
I'm Wetty Sada, Cooper Burnett, and I'm with my son Nate and my daughter Sarah.
And I'm Linda Brennan, and I'm with my daughter Rain.
I'm Rachel, here with Vital Village. And I'm Risa, here with Vital Village.
all right. So we determined that the topic was latching, and how to assess a latch, and just kind of what the goal is. And so first I just thought maybe we could talk about why actually in the breastfeeding world, this is like the number one thing. Like everything comes from the latch. Oh, do you want to hand those out? So Rachel had sent out a handout with a description of the latch on it that you might be able to refer to. But I guess from all the training that you guys have been to, any quick thoughts about why it's worth really getting to understand latching and helping moms get a baby well latched?
Because if it's not done correctly, you have just gastrointestinal issues for the baby, pain for mom,
Frustration. The baby's frustrated because they can't get on right, and they're not getting milk, and a whole lot of issues.
Yeah. And it causes nipple damage, which then makes moms afraid to put their babies to breast again for that reason. So I think what's wonderful about the handout that Rachel found was it sets the stage of helping the baby get a good latch. Just even thinking about creating a calm environment, and starting off with holding the baby skin to skin, and just learning what the baby's feeding cues, so you can let the baby lead, and how to support the baby and position the baby. So I think maybe also, if you guys don't mind, because there's only the 3 or 4 of you, if you might just tell me what you do know about latching. Just maybe one thing about it.
I know that quick fix in the hospital for moms when they're having struggles with latching is a breast shield, and that hasn't always been the case, but
yeah,
it's become really popular, and it's really hard once moms get used to that to then help them wean off of it and realize that it might have been a temporary solution, but it's not a long-term.
Yeah, I think that's a really good point. That what happens is one of the ways to help a baby get latched is time. Standing there, waiting for the baby to get oriented, get settled, start to move to the breast and open up and latch. And in the hospital, everything becomes so, nurses don't have time to wait. People don't, they feel like they got to get this baby on the breast and the baby's got to feed. So this quick and easy thing is often a nipple shield. So, so like Wati-sana said, it really can, it can be a barrier. It can be a wonderful tool. I should say that first, a really wonderful tool, but it can also be something that's hard for moms to get off of. It can later on make it even hard for the baby to get in.
It's also an issue if a baby has a lip or tongue tied. They can't really get their mouth open that big to get around it anyway.
Yeah. So anything else about latch, Linda, that you like a one just one point about it?
At the beginning, if you don't know what's going, from personal experience, not knowing exactly what's going on, it was hurt a lot because I didn't know if exactly what the perfect latch was.
Yeah.
And the pain can be extreme, but
Yeah. Yeah. It really can. Yeah. If you guys have anything.
Sure. I've done some reading.
Oh, good.
I don't have any
Okay.
personal experience. But I think one thing that I remember from one of our trainings is to avoid ever forcing the nipple into the baby's mouth, but a technique that can be used instead is the tickling of the nose with the nipple to get the baby to open its mouth on its own.
Yeah,
So that's my thing.
Yeah, that's a big one actually. That where it's so counterintuitive for moms to aim the nipple at the baby's nose. That
possibly, but if you lock the door, we'll open for them. Yeah.
If it's not, you guys tell them.
Okay. Thank you.
I think that's the hardest part because, as one of the videos points out, clearly women have been putting their baby to breast without knowing how to perfectly latch their baby for thousands of years, and babies have thrived and lived and gone on to get plenty of breast milk, but what we're learning when a baby is struggling, or we are trying to get a baby latched better, that one of the best ways is this very simple thing, is to aim the nipple at the nose, because babies will then reach up and then the nipple's right there to go right on top of the tongue. Whereas if they aim the nipple at the mouth, and we're going to watch a video of this, it goes in a way that doesn't go deep enough. But actually, I want to show you this. There's this excellent video that shows how babies latch and getting a baby latched. Everybody can watch this at home. It's from globalhealthmedia.org, and you can go to their website, click on videos, click on breastfeeding, and you can actually download it to your phone, to your computer. So especially for everybody that's going to be counseling moms, I can't say enough about this series of videos. They're done in other countries, but it's still everything that they're showing you happens here and happens with our moms. And I'm going to just bear with me. I might stop it periodically to point out different things. So, oops.
That's on there.
Yeah.
So we can see it.
Oh, wait a minute.
Projector.
So,
The movies.
So if you'll notice that they're calling it, and I got to get out of your way, Martha. So they're calling it breastfeeding attachment, but which I've always thought, there's so many different ways to say this, because attachment is almost to me a better word than latch, because it really focuses on the whole process of getting a baby well attached to the breast, so the baby's getting the milk, versus just the latch sounds very much more specific, where it's a whole body thing for the baby. And maybe even before the video, just to point out that the ways that the skills that babies have are that they can actually find the breast, find the nipple, open up their, do the right motions to open up their mouth to feed. They can actually use their hands to move the breast around, even as brand new newborns. And you'll see one baby do that. And so they very much rely on taste and smell. They rely on their body being down on mom's body, because they have pressure points on the insides of their arms, on their hands, their belly, and the insides of their knees. So when they're really belly down to mom, they feel very, very secure, and then they're kind of ready. They get in a much more ready mode to breastfeed. So this.
Breastfeeding attachment for health workers. Mothers have breastfed their babies throughout time without paying much attention to how the baby was attached to the breast. Babies may not be attached well and still thrive. However, a baby who is deeply attached to the breast will get more milk and make breastfeeding more comfortable. This video will show why good attachment is so important to breastfeeding success and how to help mothers deeply attach the baby to the breast. There's a common misunderstanding that babies get milk by simply sucking on the nipple like a straw. If it's attached only on the nipple, the baby gets very little milk. But when he takes more of the breast in his mouth, milk comes easily.
Isn't that amazing? I just wanted to show you guys that, because this is also one of the nice things to teach moms is how to hand express, and just a real quick view of how it, just like latching, to hand express by putting their fingers back. They tend to just kind of when they start just kind of squeeze right above the nipple, but if they put their hands back a little bit, they can get so much more. I love this. It's one of my. It's so clear.
How a mother attaches her baby to the breast is important for the baby's ability to get enough milk and ensure a long-term milk supply. A look inside the baby's mouth will show why. When the baby takes a big mouthful of breast, with the nipple pointed to the roof of the mouth, the nipple reaches a comfortable area deep in the baby's mouth. He uses his lower jaw and tongue to press on the pools of milk beneath the areola, releasing milk easily. Good attachment is the key to breastfeeding success.
So I think I just want to talk to you guys about this, because I think this is something, especially for those of you that are going to be taking the CLC course. What they call this approach to the breast is the asymmetrical latch. And that means that the chin is pressed in and the nose is tilted back. So basically the baby's leading with the chin, and that, but the nose is tilted back a little bit. So rather than the baby coming straight on, which you're gonna see in a second, what that effect does. But that might be some of the wording they'll use in the CLC.
In contrast, in a shallow attachment, the nipple is centered in the baby's mouth, which is not wide open.
Yeah.
The nipple lands under the hard roof of the mouth. As the baby sucks, the nipple gets pinched. This is painful and may injure the nipple. The baby is also unable to access the pools of milk beneath the areola, so cannot get much milk.
Yeah, a lot of the
How can
this woman's voice is so lovely. I'm sorry to keep interrupting you.
It's
But
like Black Panther
she has-
sisters.
what did you say, Nate?
It's like somebody from Black Panther.
It sounds like
Yeah.
a character, somebody from Black Panther,
Yeah,
the sister.
yeah. I think she's from Uganda, actually. I think that's the accent we're hearing. But you can see in this one how the chin is not touching. There's a space. So anytime, this is like sometimes an easy fix of that sometimes with moms are attached, that I'll just suggest they tuck the baby in close, and by just kind of tucking the baby, if you guys can see me, by tucking the baby with their arm sort of close in, so their belly, they pull the baby's belly in closer, that pulls the chin in closer, and it'll be a nice easy fix.
mothers help their babies attach deeply? First, start breastfeeding in the first hours after birth.
So watch this baby.
If left quiet and undisturbed, healthy newborns have instinctive feeding behaviors that help them find the breast and attach well all on their own. This gets breastfeeding off to a good start. Continuing to use this natural position can help the baby attach deeply in the early days and weeks. Next, feed the baby whenever he starts to signal his hunger. Have the mother hold her baby on her chest. This position calms him and stimulates his feeding instincts. Teach her to read her baby's hunger signals. Sucking motions of his lips, bringing a hand to his mouth, and turning his head from side to side. Now is the time to feed her baby before he starts to cry. Then hold the baby in a way that makes...
So did you guys notice in those two videos, they showed the mom laying back, and she called it the more natural position, and it's also the obviously the position that the moms will use in the first hour after delivery, because they'll still be on the table or the bed in labor and delivery. But in that case, the baby's maybe doesn't have the perfectly asymmetrical latch, but he's also just kind of face planted into the breast, and that can really help the baby latch. But you still want to make sure the baby's got an airway and that the chin's really pressed into.
and feel secure and helps him feed most easily. Have the mother bring her baby to her, holding him close, facing and touching her body. The baby's neck should be straight, not twisted, and the ear, shoulder, and hip should be in line. This will make swallowing easier. Many mothers aim the nipple in the middle of the baby's mouth. This is not ideal because the nipple will end up just inside, pressed against the hard roof of the mouth, which is painful and doesn't let the baby feed as well. Instead, align the baby's nose to the nipple. Be patient. Wait for the baby to open his mouth very wide, like a yawn. Then bring him quickly onto the breast, leading with his chin. A gentle push from behind the shoulders as the baby takes.
That's one of the hardest things to have a mom do, is waiting for that wide open mouth, because the baby will open up wide and then shut their mouth, open up, shut their mouth, and the moms then start to compensate by then aiming the nipple right at the mouth. Mm-hmm. So to help them just kind of keep staying there with the nipple up here and stroking the nose and up here can really help the baby latch.
Breast can deepen the attachment. The baby is drinking well, and breastfeeding is comfortable for the mother. In this second example, as the baby opens very wide, his lower lip is at the base of the areola and the nipple is aimed at the top of his mouth. The baby is attached deeply and drinking well. Large, round breasts can present challenges to deep attachment in young babies. Shaping the breast so it most easily fits into the angle of the baby's mouth can help the baby attach well.
So did you see what that mom did, where she essentially shaped her breast in the shape in line with the baby's mouth? Because sometimes the moms don't have always have a good angle, so they'll reach the baby's like that. Let me think about this. So the baby's mouth is like this, and they'll take their hand and press their breast like this, but the baby's mouth is really this way. So trying to help them find a position for their hand that can make that kind of sandwich squish.
So they were just showing an example of an inverted nipple.
Yeah, they're going to show one too. Yeah. So I see they show one, because all these nipples stick out until you get to that one.
Mothers are often worried their baby cannot breathe while feeding.
Yeah, that's a big one.
Reassure her that babies' noses are designed for breathing when their nose is in the breast. Also, show her how to pull her baby closer to move his nose away from the breast. How do we tell if the baby is well attached?
I just want to show you guys that because
the baby's mouth should be wide.
Sorry, let me just get back to that.
To most easily fits into the angle of the.
So watch what
Also,
happens.
show her how to pull her baby closer to move his nose away from the breast.
That brings the baby's chin right up. Just literally by.
How do we tell if the baby is well attached? The baby's mouth should be wide open. More areola is seen above the baby's mouth than below. The baby's chin is touching the breast, and the nose is free. The lower lip is turned outward, though in a well-attached baby, it is usually hidden in the breast. In contrast, this baby has a shallow attachment. She is brought on with the nipple centered in her mouth. The mouth is barely open. An equal amount of areola is seen above and below the mouth. Her chin is off the breast. While her lower lip is turned out, which is a good sign, her cheeks dimple as she sucks, a sign of shallow attachment.
I'm sorry to keep doing this, but in this case, like what they're going to do is actually detach the baby and reattach. But sometimes, just literally, what I would have had this mom at least try is just pull the baby in close, see if we could get that chin just touching the breast without detaching the baby, and see if the baby doesn't get a deeper latch just by doing it.
The top lip is visible.
Yeah, the top lip, if you could get it a little bit more out too. But sometimes those things will naturally fix if you could just really, just kind of make some minor adjustments with the mom's arm here, not pushing with the head, but pushing the body in, can sometimes help a baby get a deep latch without having to attach the baby, stress the baby out by then trying to have the baby reattached.
Baby is not well attached. Gently take the baby off the breast by putting a clean finger in the corner of her mouth to break the suction. Notice the nipple is pointed from being pinched. Assure mothers that with time and practice, attaching the baby well will get easier and more automatic. By 4 to 6 weeks, the baby's head and neck control also helps them to deepen attachment on their own. Look to see if the baby is drinking well. The baby's jaw will drop distinctly as he swallows.
So this is a big one. Can you see what that baby? Oh, shoot.
The baby who is not getting much milk will have a continuous fast sucking pattern without pauses. Ask the mother how it feels. Breastfeeding should be comfortable, except for temporary tenderness in the first few days. She should not feel pinching, pulling, or rubbing on her nipple. If it is painful, the baby is probably not well attached. Shallow attachment can lead to less and less milk being produced by the breasts. At this point, worried mothers often start to give their babies other food. As the baby fills up on other food, he won't need as much from the breast. As he sucks less and less, the mother's milk supply will decrease.
So just
breast milk
are you guys aware of that? That if a baby, especially in the early weeks, that if a baby's not latching on, is getting filled up with formula, and mom's not pumping, that's their milk supply diminishes, and that's probably one of the most common reasons moms come to us at the Baby Cafe. It'll be 2 weeks out, 4 weeks out, and their family, their wonderful, loving family, has fed the baby during the night so mom could sleep, and just kind of whenever the baby was fussy and it breastfed, the baby got formula, and now the mom is not making enough milk. and wants to bring her milk supply back. And it's one of the most challenging things. And I think one of the things that confuses moms is they'll read things like, oh, somebody can adopt a baby and make enough milk for the baby, or they'll just kind of read things that don't really relate on the internet that makes it sound like, oh, well, why can't I get my milk back? But in fact, now that they have a new baby and they kind of miss that 2 to 3 week window of really establishing their supply, it's harder to maintain feeding the baby, caring for the baby, and do all the pumping and things that somebody who was preparing for an adopted baby would be doing. So it's if we can catch these moms earlier is one of the biggest challenges that I think we have before us.
Best nutrition for the baby. Be sure every mother in your care learns how to attach her baby well to her breast. This will lead to good sucking and plenty of breast milk, and no need to give the baby any other food in the first 6 months of life. Remember, breastfeeding should be comfortable. The baby feeds from the breast, not the nipple. A well-attached baby will make more milk come.
So, any other thought from you guys about that?
I know that you said the one term that I remember you saying was asymmetrical latch.
Yeah.
That might be something that comes up in that particular video, but may also show up in the language for the CLC training. Were there any other terms?
I think I don't know. Yeah, that's a good.
Sorry, what was the term?
Asymmetrical latch. Might be the way that I think that's the way they teach it. Again, I don't. I'm hoping to get some of their material to better know how they teach this, but I think the common things among everybody that's teaching this is the importance of positioning the baby so the baby's belly to belly in a straight line, holding close to mom. That you know that the baby wants to get more. That's another thing I think they'll probably teach is that the baby needs to get a little more of the areola underneath the nipple than above the nipple. But that also adds to the picture of the asymmetrical latch. And just the importance of latching and why we're trying to, why there's so much emphasis on it. You know, it's a big part of courses for teaching healthcare workers or people providing support, and it's also in breastfeeding class videos. The biggest section is always about the latch or attachment too.
One thing I think that, especially healthcare providers, in maternity wards, is how to recognize a lip or tongue tie, because that's usually the biggest one.
So
I've actually had friends who, found out that their baby did have a lip or tongue tie, and the hospital said, "Oh, there's nothing."
So I think that is really important. About 5 to 10% of babies do have a lip or tongue tie. But I think as from our focus of what we're doing, one of the things that we also really need to be able to tell is, yes, so maybe we have rolled that out, but have we also just checked to make sure that the baby's got a good latch and a good attachment? There's actually a lot of debate in the medical world about treating lip and tongue tie, that it's not a black and white thing. So for us to even, at the level that we are, for us to even always kind of say that we have to be careful. We have to be careful about what our scope of practice is, and also just I think in that, if you suspect the lip or tongue tie, well, actually, tell me what you would do if you suspect. Like if you see somebody, have you seen somebody?
A friend of mine who actually had her second child.
Yeah.
She's like, she knew what a latch was, and she's like, the latch feels weird. I think, does it look like something? I'm like, possibly go get it checked.
Yeah, and that's the best thing you can do, and ask them to have their pediatrician assess it. I think and even as an IBCLC, that's what I do. I will say, I think this baby might have a tongue tie, and this is what that means, and these are the symptoms, but talk to your pediatrician, see if they can refer you to either a dentist or an ear, nose, and throat doctor. So, but I think when you think about the fact that there really is 5 to 10% of babies have that we've still got 90% of babies that are either going to be latching fine without a problem, or there's a problem. Mom comes in, and can we help her get comfortable with all these other abilities to how to teach her how to get a good latch.
I actually got to do that for me, and like, this doesn't work. I'm like, have you tried this? No, I didn't know about that. I'm gonna try that when I get home.
Yeah, and yeah.
I'm wondering how much of. I mean, I know there's no real answer to this question, but I ask anyway. How much of breastfeeding well and having a good attachment or getting that connection has to do with comfort with your own body? Like, is there anything to be said?
That's a really good question. I'm actually thinking of this mom that came in last night, because I think that can absolutely factor into it. If you have someone dealing with nipple pain, and like this mom came in last night that hadn't been putting the baby to breast because the baby had caused so much pain and some nipple damage that she was afraid. So she was actually coming in to find out how she could get more milk pumping. But I ended up kind of seeing if we could talk her into putting the baby to breast. And so we tried. She had flat nipples, and that were also a little damaged. So, and she just could not bring the baby. I kept suggesting she pull the baby in. She just couldn't because she was so afraid of the pain. So, I actually ended up trying a Nipple Shield because I thought, well, maybe if we can get her started with a Nipple Shield, we can then work off of it again. Mm-hmm. So that was. And I'm not really positive that was the most perfect thing, but that was what I ended up doing. But I didn't see a tongue tie, but she had flat nipples. And that may have been why the baby was causing some pain with that. And that's actually one of the things that video doesn't address is when moms have inverted or flat nipples. Did they show some of this inverted nipple? I watched
two videos. They showed someone with the flat nipple. They didn't show the
inverted nipple. There's another one I have where they do show that. But so an inverted nipple, just for anybody that doesn't know, is a nipple that actually is tucked into the areola. And a test to find out if you have an inverted nipple is if you put your thumb above the areola and your finger below the areola and squeeze. If the nipple pulls back, that's an indication that the nipple is inverted versus popping out. Yeah, I wish I should have brought my breast to show. But you can see that the nipple feels like it's getting pulled back into the breast. Sometimes it's very obvious, like you actually can see that the nipple's like a little tucked into the areola, and it's very obvious.
It wasn't the fact that I actually saw someone with them really.
Yeah, and it's a challenge for the baby. And if the baby is born a little early, doesn't have a super strong suck yet, is small, so the mouth is tiny, the baby may have various. The inverted nipple can add to the baby's difficulties. So sometimes that's another kind of shield may be really helpful.
So if the nipple's flat and people that are assessing it are saying maybe it's inverted, and you know to do the test with the squeezing, if it's not inverted, will it just like pop out?
Well, it won't pop out exactly, but it'll put, like when you squeeze. Sorry for using my breast, but if you squeeze, it sort of pops out a little bit. Whereas if you squeeze and you're inverted, it would actually tuck in.
Okay.
So even a flat nipple will just sort of like one other term we use for flat nipples that are easier for a baby to grasp are called pliable nipples, meaning it feels very soft and the nipple compresses easily, whereas an inverted nipple, you often you can see that it's got sort of thicker tissue underneath it, which adds to the challenge of the baby.
So if it's viable, then the latch can be
babies
totally
can
fine.
yeah, babies can often latch much more easily. The only other observation I've made over the years is I think because moms with flat nipples their nipples have not been toughened up. Like a nipple that sticks out, the skin around it is thicker. Whereas when you've got a flat nipple, it's getting pulled out and the skin is more sensitive. So I think those moms sometimes have pain, even though the latch is good. The babies doesn't have a tongue tie. Baby's suckling well, but they might go through a period of discomfort that we need to help them through just by virtue of having flatter nipples too. But everybody we saw here has quite everted nipples. I just want to show you real quick just some short videos. These are videos that moms, one's from a webinar I took. This is just like beautiful, perfect latch just for your viewing pleasure. And then I want to say something about, oh, come on, get up. All right. And you can see this baby's like, this is like the best, one of the best views. Isn't that like such a wide open mouth? The lips are flanged.
He's an older baby too, right?
Yeah, he's probably, I don't think he's
like
that old.
3 months maybe.
Oh, no, I don't think he's that old. But I would maybe say a couple weeks. Yeah.
Look at the hair going.
Which,
That's just like like control.
But,
like not.
Yeah, but look at how much he's pausing. Like an older baby doesn't pause this much. And I like this video to show how often babies will pause when they're eating. Oh, then, it's hard to say. Yeah, he's very alert. Yeah.
I feel like I know this baby. We've like seen this video so many times. I'm like, I know.
Right. So, but that's a good point, about asking how old he is. I really think if you ever talking to a friend or a mom who's pregnant or going to have a baby, one of the things that I feel like we set moms up for if we do give them education about breastfeeding ahead of time is that they've got to get it exactly right on day one. And that I heard this
Yes.
heard this nice, not nice, but for me was really reassuring statistic that 95% of babies don't latch perfectly in the first 2 to 3 days. That they're gonna be imperfect. It's gonna maybe hurt a little bit in the beginning, or it might hurt intermittently. You need to reattach, but it's really a learning process for your baby, and so to not be worried about what the baby's doing. So one of the other things this baby's not showing, let me just see. I think, oh, and actually this is from that same webinar. Let me just show you this. This is a baby with a nipple shield who will tell me what you think about this baby's latch.
Oh wow, that's shallow.
Yeah, and can you see he's not swallowing? He's just doing those short little sucks.
And the cheeks don't go anywhere.
Yeah.
Oh look, nipple shield.
Yeah, and even with the nipple shield, you can get a much deeper latch than he's getting, but he's just not. And you can see the nipple's not really, like when they've really got it good.
Yeah.
The nipple, sorry, let me point. The nipple's often really pulled right into the shield, so that way you really know that he's not super attached. But I think one of the other things that I found when you're counseling new moms about babies, one of the I mentioned, so I started to talk about the skills that babies have where they can actually find the breast, they use their hands, and by using their hands, they go like this, and they also use their hands to move themselves. So they'll, especially in that, if you ever watch a video of the breast crawl, that's what they do. They push up with their hands, lift their head up, and move forward, and they kick with their feet. And they're kicking with their feet, they're pushing with their hands, And so if you have a baby who's like in a cradle position or across mom's chest, sometimes they're struggling to latch. And so they put everything they've got into motion, which is they push with their hands, they move their head back and forth because they're trying to find the nipple. So how would you read this? Push. No, I don't know. And so that's one of the things I'm always trying to help moms interpret their baby's behaviors cues is, oops, where is it? Where is it? Where is it? Or I'm trying to find it. I'm trying to find it. And even though it's right here and it's hitting their mouth, they still, babies don't, it takes them, can take them a minute, 2 minutes to register. And then all of a sudden, if you can just keep them brushing up against the nipple, feeling the nipple, keep the baby tucked in close, then the baby will all of a sudden latch on. Often.
It almost seems like sometimes like they're looking for something the way we look for something in your purse without your eyes.
Yeah.
Because sometimes they're looking, but they're not like they're using their eyes. They're just using their senses and the smell.
Yeah.
As the predominant.
Yeah.
Until they get older, of course. But
yeah, that's a great analogy.
I think it's interesting that we also can. I'm sure I've seen that we can lose those cues because if, like anybody, if you keep doing the same thing and you're not getting the breast or it's not being
working,
received, you're like, oh, I guess.
Yeah, then they just, I guess that doesn't work. Yeah,
right.
They just give up. Yeah. But
well, if you're not given the information of this is what's going on, they're like, oh, I guess they don't want it.
Yeah, and that's like the parents last night, the baby was doing that a little bit and they said, oh, I guess the dad said, oh, I think he doesn't want it. So that's another thing that's really helpful, for breastfeeding counselors to help people interpret what their baby's doing. So it really helps to know that pushing with the hands and lifting the head is actually what they're doing to find the breast.
Like they're trying to like gain their bearings.
Yeah. And it's actually one of the reasons that we're actually going more and more to suggesting moms lean back. Because if a baby pushes with his hands and lifts his head, gravity pulls him back down. So he gets less frantic. Because if he's not relying on his mother to pull him in, gravity just naturally does it. So you see him kind of like bobbing and bumping into the breast, and then they go like this, and then they latch on.
I think it's also something people don't expect in terms of like, we have this idea like, oh, babies don't really become mobile until they're like crawling. So like the whole idea that a newborn could move anywhere to get something, like I think is kind of.
Rain was already lifting her heads up with her arms day one.
Yeah.
It was like,
well, I think that's, again, back to the CLC. I believe that's another thing they're going to go over is that first hour after birth, where they've encouraged the mom to be holding the baby skin to skin and to watch the baby go through those steps that they do in that first hour. And I'm pretty sure they'll be doing it because they actually were the ones that came up with this concept of these 9 phases that babies go through in that first hour, which is sort of this stunned phase. And then they cry, they lay there, they cry, and then they start to move a little bit. They quiet down, they start to salivate. And then they also lift up their head and they gaze at mom. There's like one particular step in there where they pretty much always will lift their head to do that eye-to-eye gaze. And then they'll start to more actively search for the breast and hopefully breastfeed. But it's a gradual between he's kind of being stunned to be here, crying about it, going maybe sleeping a little bit, for a few minutes, and then crying again, waking up. So again on YouTube, there's some wonderful breast cry, and actually on Global Health Media, there's that first hour video too that I think it's really worth you guys watching in preparation for the IBCLC. Because for me, just seeing these visuals, I think helps me take in the information better. And because anytime I've learned over the years I've learned so much from conferences, because often presenters will give you pictures or videos that help really bring what they're saying home versus just looking at things on statements on PowerPoint and just trying to memorize stuff. So maybe just I'm thinking in preparation that might be really helpful. We go till 7. Is that, or what's the time frame?
The time frame could be till 7:30, but also we have been kind of transitioning to mix 5:30 to 7 in some of our evening meetings and seeing how it goes. So really, whenever you're done.
Okay.
But not later than 7:30.
So,
They pretty much keep us at 7:30.
so then if you guys would be all right, I'd like to show you another video that actually is for healthcare workers and things you can do to help moms. And one of the things that they show in here is this assessment page. So I'm going to pass these out. It's actually developed by UNICEF. And it's called the Breastfeed Observation Aid. And you'll see it in the video where it gives different things that you can look for while you're helping a mom feed. I wish I could figure out how to just. I guess I've got my volume up as high as I can.
Breastfeeding attachment for health workers. Mothers have breastfed their babies throughout time without paying much attention to how the baby was attached to the breast. Babies may not be attached well and still thrive.
So sorry.
Good test.
You guys did.
Helping a breastfeeding mother for health workers. Most mothers want to breastfeed, knowing it's best for their babies, but it can be difficult for some of them. With observation and tactful guidance, you can help mothers prevent problems and succeed with breastfeeding. Assessing a mother while she is breastfeeding her baby can help identify what is going well and what can be improved to feed her baby most effectively. Use your communication skills to listen, observe, respond, and build her confidence. This video shows how to observe and support a breastfeeding mother using the Breastfeeding Observation Aid. The Breastfeeding Observation Aid is a tool that will help sharpen your observation skills by breaking down the elements that make up successful breastfeeding. There are 6 sections: the mother in general, her baby, her breasts, the baby's position, his attachment, and suckling. Within each section are signs to observe that tell you whether breastfeeding is going well or signs of possible difficulty. The sign is marked when it's observed. If all the marks are on the left side, then breastfeeding is probably going well. If there are marks on the right side, there may be difficulties that need to be addressed. First, observe the mother in general. Here's a healthy mother who is bonding well with her young baby. She has eye contact and holds him securely. This mother has no eye contact with her baby and holds her loosely. She looks distracted and tired. This mother has poor posture while feeding her baby. But sitting up straight is more comfortable and lets her hold her baby close. Second, observe the baby. This baby looks healthy and calm. His mouth movements show his interest in feeding. In contrast, this baby is crying and batting at the breast. And this one shows no interest when the breast is offered. Third, As the mother prepares to feed her baby, what do you notice about her breasts? This mother's nipples look healthy. This mother's nipples are fissured. She grimaces in pain when her baby attaches. Here is a well-attached baby. The mother's nipples look normal and round when the baby comes off the breast. This baby has a shallow attachment. The nipple is pointed from being pinched between the baby's tongue and hard palate. Here, we compare it to the round nipple that is positioned further back in the comfortable place in the baby's mouth. Most nipples protrude and are easy for babies to grasp. This woman's nipples are inverted. Healthy babies can usually draw out inverted nipples by attaching a few times. This baby takes a big mouthful of breast, attaches, and starts to suck.
Yeah, that helps a lot.
This mother supports her breast with her fingers away from the nipple, giving the baby room to attach. Here, the mother's fingers are too close to the nipple. They'll be in the way of the baby taking a large mouthful of her breast. Fourth, observe the baby's position. This baby is held close with his ear, shoulder, and hip in line, facing the breast. And his nose is opposite the nipple. Here, the baby is held loosely. His neck is twisted, and his body is not facing the breast. His mouth is opposite the nipple, in contrast to this baby, whose nose is opposite the nipple. Fifth, observe the baby's attachment. This baby is well attached. His mouth is wide open. More areola is seen above the baby's mouth than below. The baby's chin is deep in the breast, and the nose is free. The lower lip is probably turned outward, though in this well-attached baby, it is hidden in the breast. Here, the baby has a shallow attachment. The mouth is barely open. An equal amount of areola is seen above and below the mouth. Her chin is off the breast. While her lower lip is turned out, which is a good sign, her cheeks dimple as she sucks, a sign of shallow attachment. This baby's lower lip is turned inward, a sign he is not well attached. Here, we compare side by side. How open is the mouth? Is the areola seen above the baby's mouth? Is the chin touching the breast? Is the lower lip turned out?
I have to say they don't really.
Six.
On the left, you can't really see the lower lip. So sometimes you just go on. You could just kind of take a little peek with the mom. But if the mom's not complaining of pain, you can see that the baby's swallowing deeply. Then I think you can just assume, and you see more areola above the lip. But that's always a little bit of a challenge when you're assessing a latch.
Observe the baby suckling. This baby is not well attached. He is taking rapid, shallow sucks without the pauses that indicate he is swallowing milk. He is also getting sleepy because the flow of milk is slow. When the same baby is better attached, we see deeper rhythmical motions of his jaw. Now each suck this baby takes results in a swallow of milk. His cheeks are round when suckling, and he is alert now. This baby's cheeks are dimpling, a sign that the attachment is shallow. Always observe a mother before offering help, and then only offer help if there is difficulty. The goal is to help her position and attach her baby by herself and become more confident. If you can position the baby, but the mother is not able to herself, this doesn't help the mother's confidence.
And that is what nurses do. Drives me nuts.
I think like
Yeah,
that's
just what
exactly
that
how I
woman did.
experienced it.
Yeah, they come in, they hold your breast, they hold the baby, and then the moms leave the hospital, sometimes having rarely put the baby to breast themselves. So it's really,
My
I
first
think
time
that's
was
such a critical point. Talk her through it, but help her figure it out and feel it with her own body, because she gets that body memory of how she did it. She's going to then leave wherever she is with you, say at the baby cafe, and can go home and hopefully recreate it.
My very first experience was nurse comes in, I do lactation, throws me into a chair, puts 8 pillows around me, throws a baby on me, goes, looks good, and walks out.
Yeah, that's very common.
When a mother comes to you with difficulty breastfeeding, try these steps to understand her problem and guide her to improve how she feeds her baby. Ask the mother how breastfeeding is going. Listen openly to what she tells you. Ask her if you may see how the baby is feeding. Removing some of his wraps will let you see his position better. Have the mother put her baby to the breast in her usual way. As you look and listen, keep in mind the points of the Breastfeeding Observation aid. Tell the mother when you notice what she and her baby are doing right. This will encourage her and build her confidence.
I think that's such a wonderful point, that you start off with telling the mom what she's doing right. And it's something that really took me some time to learn the dance of that, to say, yeah, this looks good this way, but let's try this to see if we can get the baby a little closer, whatever. But
especially if they're coming in like, I'm in pain, like you just want to kind of dive into like, this is how you could fix this, and dive into like delay that and say, well, this is what, it's not all bad.
Yeah, right. Yeah, they'll give you a history of like offering a lot of formula or something else, and it's I think very tempting to say, well, this has happened because you gave the baby so much formula, but that's not going to work, because it's just going to make her feel bad, and it's going to already put up a barrier between you. So I love that I just love these videos, because I think in 10 or 11 minutes, they touch on so many very key points. So like every sentence this woman utters in her beautiful lilting accent is so perfect. They're just beautifully designed for helping.
If you notice a difficulty, explain what might help. Here, you notice that the baby slips easily off the nipple. Holding her baby closer might help. Ask the mother if she would like you to show her. First, show her with your hand on your own body. You may also need to use your hand to gently guide her. Talk about the key points the mother can see when breastfeeding, so that the mother is confident and effective on her own. Remember, help a breastfeeding mother by first observing her feeding her baby. Keep in mind the 6 breastfeeding observations: the mother, the baby, the breast, the baby's position, attachment, and suckling. Praise what is going well and tactfully guide her, so that she will learn how to position and attach her baby herself.
those are just two. Real quickly, I just do I have the internet? I'm gonna. Say it again. It's usually up there somewhere. Let me. Well, and I guess I don't absolutely need to show you, but I just encourage anybody to explore the globalhealthmedia.org. Maybe when you send the video, I could send you the link too. And just because I think it may really be if you look at them, if you go into breastfeeding, there's several that are for mothers. Some of them get more advanced, like they're for premature babies and also supplementing. But I think even just getting the really basic ones, like the first hour after, maybe I'll send some suggestions. The first hour, the attachment, positioning the baby. All of it is things that they're going to be talking about in the CLC course. And I think it's going to help to have maybe have some of these visuals when you see them to refer to. And because I just think they've fine-tuned this down to a wonderful, even this is a very well thought out list of kind of check things that I can't always imagine myself standing there checking things, but sort of getting to know what the things that you would be looking for.
I have a question.
Yeah.
Under suckling on this checklist is the one that says mother notices signs of oxytocin reflex. Is that like when people say let down?
Oh yes, yeah. That's a good question. I didn't realize I didn't get down that far.
It's the
very bottom one.
Right. Although I would that's a nice thing, but not all moms feel that let down. Like some moms will feel a tingling, they'll feel a rush. Other moms get worried because they're not feeling it, but that's just another point to reassure them that it's okay. Because if they watch their baby, you can see their baby just, swallowing. Their baby's just clearly getting big gulps. They're having that letdown. So any other thoughts?
I feel like it's so much relational and technical. It's like such a mix of.
Yeah.
You can know all the information, but if you don't know how to deliver it in a way that's really makes the mom feel comfortable receiving it.
Yeah, and I think they start from some nice, at least basic points, even though, like you said, you could run into somebody who has feelings about their own body that might help them, or just will help them not with breastfeeding. Then they showed that mom who's kind of disinterested. You do sometimes run into that where mom is either depressed or simply not getting enough sleep. And so the way she's interacting with the baby doesn't seem as connected as it might. If you can help her kind of get to the bottom of that. And which, of the breastfeeding aversion, is a tough problem. But I think the more you kind of know what the basic things are, so that you can get kind of all those things rolled out, and then you may get a hint. The more you get used to that, the more you get to know them really well. Then as a lactation counselor, you start to really pretty quickly come down to, I think something else is going here. How can we help you? Or I think I'm trying to work out ways, but it's really sometimes a pretty intimate relationship with a breastfeeding mom. Like even just in the short time yesterday, there's moments where this mom, when we did get this baby latched on, even though it was with a shield, her whole body, her whole demeanor changed because it suddenly wasn't painful. She was so excited that the baby was breastfeeding at the breast, and it was so gratifying and it was like she kept wanting to hug me because just for that simple thing. So I'm hoping, again, and I'm thinking, okay, I hope this continues, but it's still really, really a good feeling to figure something out that might help them. Let's get them along the way.
Yeah.
So
It's such a vulnerable time. Like,
yeah.
You're so worried about caring about your baby.
Yeah.
It's like,
yeah.
and feeding them is like the number one.
Yeah, and really everybody, not everybody, but 90% of moms, 95% of moms really do want to breastfeed. And really the gap is, are we getting the right help to them at the right time? Well, thanks.
Yeah,
I think I'm going to maybe end the recording.
Yeah,
Let me just.
that was awesome. That was like a real. That's gonna be a